everyone. Welcome to the 10th episode of Caffeinated Coverage Talk with Michelle and Todd. I am Michelle Burnt, your co-host, president and partner at InsurTech Hub.
I am Todd Hall, CEO and founder.
And we are excited for multiple reasons today. You may have seen on social media last week, we announced our new partnership with 360 Benefit Solutions. Yeah.
Yay!
And that partnership is all about our new Medicare division. So I am super excited to introduce actually a very dear friend of mine and a titan in the industry, Lindsey Wielgosz. Welcome, Lindsey.
Thank you so much. I'm so happy to be here and to be partnered with you guys and bring Medicare to your fan base. You guys have an incredible company and we are so excited to be a part of it.
Yes, yes. So Lindsey and I have actually known each other for years. And so I told Todd about this this company and Gary and Lindsey, and I'm like, you got to meet them. I mean, I talk a lot about them. The moment Todd met you and Gary, Lindsey, he's like, done deal. Where do we sign? Let's partner. We've been thinking about adding Medicare to all the hundreds of products we offer. And I think it's going to be a game changer this year.
Absolutely.
Amen.
It's a wonderful industry to be in.
Yes. So before we dive in, the whole topic is about caffeination. How do you stay caffeinated, Lindsey?
I'll give you one guess. What do you think that my drink of choice is? Even
I
at
know what it is. I know
Yeah.
what it is.
It's not fair because I actually know what it is too.
I
Yes.
still
Yay!
have my Christmas themed Diet Cokes going.
So even when she travels, she will literally have her Diet Cokes with her. Like I love it. It's so awesome.
I just don't understand why people like Pepsi. It's just, I don't like it.
Do you
So
drink
they
coffee
don't.
at all?
I agree with you. I'm a Coke Zero kind of guy or Diet
I know,
Coke.
right?
Mhm.
I like either one. I just am not a Pepsi fan. And when we go to Mexico, because we do, and we find a resort, that's one of the stipulations is they have to be a Coke product and not a Pepsi product location.
I am not surprised. That is so awesome. So have you ever drank coffee like in college or anything?
No,
Ah, we can still be friends.
I know. I like coffee. I enjoy a coffee drink once in a while. It's just not my staple. When I get up in the morning, I don't want a hot drink. So I like iced
There,
coffee. I just don't make it at home.
there's a rumor that you like it with Bailey's in it occasionally. So I don't know if I've heard if that's true or not. They got
That is true.
say
In Mexico.
That's true. In
in
Mexico.
In
Mexico,
Mexico.
correct? Yeah, they
Yeah.
got.
We did so much this year when we went to Mexico, but last year that was like one of our staples. Every morning we all went down and got a coffee with Bailey's, but we didn't really do that much this year, so we changed it up.
Yeah, different
You've been
venue.
working too much.
Yeah.
Yes, I know.
We did some good work this year on our trip.
We
Mhm.
did. So Todd,
It
what
brought
kind of
us to
coffee?
this podcast today.
It did. That's
Mhm.
true. Like on the trip is when we're like, what if
Yeah,
we
we were sitting at
partner
the
together?
beach.
Yeah.
Mhm.
Maybe we should go to the beach more often.
I agree.
Todd, what about you?
You know, I'm a Dunkin' Donuts kind of guy. I'm a standard original coffee and just a little bit. I used to put a whole lot of cream, a whole lot of sugar, but I am trying to be a little bit healthier as I get older now. So the cream and sugar is kind of, a lot less, but just a Dunkin' Donuts kind of. I'm a traditional coffee.
So Todd puts honey in his coffee, and my
Yeah,
husband puts agave in it, and it's better for you than all that sugar.
that
Yeah.
is true.
I like honey in my tea.
Ooh. So I am a Starbucks girl. In fact, I even have the Starbucks mugs.
Hmm.
I'm one of those girls, but I don't know. I grew up on Starbucks. I like it, but I don't like the pricing, but I do like the coffee.
They have the Starbucks. They have the blonde flavor, which is kind of a lighter roast.
Yep.
So that's pretty good too. Yes. Mhm.
Yes.
Well,
All
cheers.
right. Well, I guess we
Cheers.
should
Mhm.
yes, cheers. Wait. Cheers.
Cheers.
Love it. So let's dive in because we have had agents chomping at the bit for us to announce this Medicare partnership. So Lindsey, start off with because I'm not even really savvy in Medicare because I come from the under 65 product. So just tell us, what is Medicare?
It's it can be complicated. It can be
It's a
very
beast.
confusing. It can be very overwhelming for both an agent and a consumer. So and Medicare it's one of those things it sounds simple. People think I'll turn 65, Medicare is going to take care of me, but it's actually kind of the opposite of that. It is a federally run health insurance program. It's run by the Centers for Medicare and Medicaid Services. So it's federally standard, your Medicare Part A and B. Most people become eligible at age 65. And that's kind of what most people know about Medicare is when I turn 65, I'm
Yep.
set. I get Medicare. Some people can qualify earlier due to disability or certain medical conditions. But for the most part, as long as you've worked your 40 quarters, you are eligible for Medicare Part A at age 65, and then you can enroll in Medicare Part B. So it's not just a standard health insurance plan. It's actually made up of four parts. There's a lot of acronyms when it comes to Medicare.
Wow.
That's probably the most confusing part. But standard original Medicare is A and B. And then you have C and D. And so, whenever you're sitting with a consumer, someone turning 65 and explaining all of this, you can just see the kind of, the questions and the bubbles going off. Like, what do I need? What do I have to have? You hear, I'm penalized if I don't do it. And, how much does it cost? The basics cover hospital care, medical, out of pocket, and prescriptions, but not at 100%. So the Medicare out-of-pocket risks are probably the most misunderstood part of Medicare in thinking that if I'm on Medicare, I'm set. And the reality is it's really a cost share. It's not full coverage. So people often, are surprised to learn that Medicare does not cap out-of-pocket expenses. So if you just have original Medicare and you are, in a catastrophic event, your out-of-pocket costs can be catastrophic. So what we do is help people understand what are the basics, what are the deductibles, the co-insurance, using some insurance terms there, but figuring all that out and just choosing the right Medicare setup for each individual. Just helping people understand that Medicare by itself leaves you
Yeah.
exposed. And it's not free, but it can be cost effective. And we have multiple different options on how to help people set up their Medicare coverage to protect them, protect their family, and get them the coverage that they need. Often it just takes a little bit of explaining and helping them understand the Medicare costs.
Mhm.
Yeah, so you're helping them navigate. Like, would you agree Medicare is not something you can just sign up for on your own? Like you got to know your choices and your options and how to navigate and
Yes.
Mhm.
So often, people will come to us and say, I'm turning 65 next year and I've got a mailbox full of junk that says this is free, that's free. I get dental insurance here. My doctor takes this. There's just so much confusion out there, all the ads on TV and things like that. A
Mhm.
lot of people think there's no monthly premium because you have, plans advertising that out there. But the reality is that there's a very small portion of the population that is actually true. And then people don't understand there's still a deductible, there's still a 20%, that you have to pay, and that it doesn't cover prescriptions by itself. So you have to actually enroll in a prescription drug plan.
Mhm.
So the cost can really be unpredictable. And what we excel at is helping people understand what the costs are and what their choices are, and help them to get it right the first time because there's not always a chance to make changes later when it comes to Medicare. So, some things are required at certain times as well. So when you turn 65, to one person A, they may be required to get A and B and D, let's say. But person B may not be in that boat. Maybe they have employer health insurance that fills that void, for now, and they don't have to get it till they're 68 or 70.
right, right.
Mhm.
So each individual is very unique in their qualifying for Medicare and what their options are and the timing of those options.
Mhm.
Hmm.
Lindsay, you just mentioned earlier that Medicare can be complex.
Mhm.
And in my 30 plus years in the industry, I think Medicare is about the only thing I have not been involved in on the
Mhm.
sales side. And but a lot of our agent partners through the years have been very involved in Medicare, but it can be complex. I hear all these different names. I hear original Medicare, I hear
Mhm.
Medicare Advantage, Medicare Supplement, the
Mhm.
different types. Could you maybe explain the differences in those different types of Medicare?
Absolutely. And this is probably the conversation I have the most, whether it's training an agent or talking to a consumer, is explaining, what all of these things are and
Mhm.
how might they benefit you. So original Medicare is Medicare A and B. So Medicare A is hospitalization coverage, and Medicare Part B is for out-of-pocket, like doctor visits and things like that, surgery, outpatient procedures. But they're not 100% coverage. So in general, Medicare covers 80%, and there are copays and 20% coinsurance without any cap on out-of-pocket costs. So if someone just has original Medicare A and B, they don't have any out-of-pocket cost protection and they don't have any prescription drug protection or coverage. So that's when your choices really come into play. Is how can I protect myself against deductibles, coinsurance, that high
Right.
20%, that's possible. And then also get the requirement in place for prescription drugs, which prescription drug plan is called Medicare Part D. And you can get the drug plan via a Medicare Advantage plan, which would include a drug plan, or you can purchase a standalone Medicare prescription drug plan. And that's probably the most confusing is I can get, this coverage in more than one place. So what's the right choice for me?
Yeah.
And so A and B is, pretty standard. A comes for free if as long as you've, paid in your taxes. But Part B is you have to pay a premium. And so the premium is, it changes year to year, somewhere between $250, $275 a month for most people. And that can change even based on your income. So whenever you're getting close to retirement, starting these conversations a couple of years prior to 65 is important because some people are able to manipulate their tax returns in order to not have to pay an extra premium for their Medicare. So we work with a lot of financial planners and things like that to help people in those situations because you can end up paying $600 a month for your Medicare Part B
Hmm.
rather than the standard. Or you can pay less if your income is lower.
Mhm.
So that's original Medicare. And then you can purchase the standalone drug plan. And have you ever heard of Medigap or a Medicare supplement?
Yes.
Okay.
Mhm.
Yes.
So that's very common with someone that's turning 65 that may have had employer coverage for a long time and they want something that functions like what they're used to, or if they want predictable costs. So
Mhm.
with a Medicare supplement, traditionally you pay a higher monthly premium and you have a very fixed cost when it comes to your care for your medical out of pocket. Um, you have to pay for your Medicare Part B no matter what. So if you choose to have a Medicare supplement or Medigap plan, that's an additional monthly premium. It can be $100, $150, it can go up from there and cover up to 100% of those out-of-pocket costs, the full 20% that
Right.
Medicare doesn't cover. So for someone who has maybe been going through some health challenges and they have a lot of predictable out-of-pocket costs, that can be a really great way to reduce their risk on what they would have to pay out of pocket because it's a standard monthly premium. And then they know exactly what their out-of-pocket would be, which in some cases is zero. In some cases, it's maybe a small deductible. But you can't always purchase a Medicare supplement plan. And I think we'll talk about that a little bit later on when you can get something for what's called guaranteed issue.
Okay.
So for that person who has, health challenges or maybe going through some, chemotherapy or something like that,
Yeah.
the timing really comes into play on when and what product they should purchase. So with Medicare supplement, it's very cost effective and easy to purchase right at age 65. Later on, it can get a little more difficult. The other option is Medicare Advantage or Part C of Medicare. These are private, independent insurance companies providing this coverage. It will often include prescription, sometimes even dental and vision, but it's going to be a lower monthly premium, but you have fixed out-of-pocket costs.
Okay.
So it might be, when you see the advertisements for zero monthly premium, that's going to be a Medicare Advantage plan, likely an HMO Advantage plan, because the more limitations you have in your network, the lower the monthly premium is. But that can be extremely advantageous for someone who's on a fixed income. So for a lot of retirees, it's more important to have a fixed monthly cost. And then, okay, I can handle paying a copay,
Yep.
or, if I go to the hospital and I know that my maximum that I would have to pay is $2,000 or whatever it is, then that's okay. But the biggest challenge that people face is not understanding what those fixed costs are, and really what their options are. And Medicare Advantage is wonderful, but they are network based. So a big part of our job is saying, okay, tell me, who are your doctors? Who are your must see doctors? And what are your prescriptions? And what we have a system that we can plug all that information in and help them find what
Wow.
Medicare Advantage plans are available in their area, what the costs are, if their doctors are in network, and help them predict what their annual out-of-pocket might be for their individual situation. So
Mhm.
again, another reason to use a broker is to help really make those initial Medicare enrollment choices, and know what their risks and rewards are based on the plan that they choose. So Medicare Advantage, Medicare Supplement, both great options, but they're a different subset of the population, I would say.
Yeah. Just based on the first two questions, I appreciate Medicare agents so much more now. Like,
Amen.
Yeah.
Hmm.
holy moly. So this question's not even on what we wrote down, but like, is this why typically if you sell Medicare, sometimes you just don't even focus under 65 products because there's so much to focus on with Medicare? Like, how
There
do you do
really is.
both?
Yeah,
Right.
there's so much to
Hmm.
learn, so much to help people understand, especially the year round when people are turning 65. I think that is the most important time to have an agent or a broker to help you with all of this stuff, because your initial Medicare decisions can last a lifetime. You do get opportunities to change plans later, but you may not have to, depending on what your choices are up front. And every person has different choices based on their zip code, based on what doctors, because everything's network based. Just like an HMO or a PPO, unless you have a Medicare Advantage or a Medicare supplement plan, a lot of them eliminate having to use a network.
Yeah.
So if you have someone
Hmm.
that travels all the time, and they just went on their own and enrolled in the first free Medicare Advantage plan that they saw, and then they went to, travel 6 months out of the year to find that their plan won't work for them.
Wow.
So
Yeah.
there's a lot of things to consider.
It's crucial that they get that good sound advice of
Up
where to
front.
go, what plan. Yeah,
Yeah,
that's
Yeah.
crucial.
So
Hmm.
before
absolutely.
we move on to the next question, one thing I want to repeat that you said for our listeners is um, don't wait till you're 65. People have in their mindset, I turned 65, now it's time to do Medicare.
Mhm.
You are smart to start a year or two in advance, start speaking to your insurance agent and your financial planner, because
Mhm.
like Lindsey mentioned, there may be some advantages to starting early. So don't wait till that 65th birthday. I want to make sure everyone heard that part for sure.
Even,
Hmm.
Medicare allows you to make actual decisions 3 months prior to turning 65. So
Okay.
while your coverage won't begin until the month that you turn 65 in most cases, you can start those enrollments 3 months prior to that. So the timing absolutely matters. There's different enrollment periods, but your initial enrollment period, in that 3 months prior to and the month that you turn 65 is most important.
Hmm.
Okay. Are my plans based on health needs and budget?
Yes, 100%. And, like I said, a lot of people don't know what they're doing and they just sign up for the first thing that they see or what's least expensive or whatever. However, Medicare is just kind of a framework. It's very powerful, but there's a lot of gaps. And if you don't fill them in correctly, you can end up paying a lot more than what's expected or what you have, set out for.
Good to know.
So the planning definitely makes a difference. We look at doctors, prescriptions, frequency of care, even looking into kind of long-term health trends, not just what do you need today, what prescriptions do you take today, but let's look over the next 5 to 10 years and, try to make a plan. Is it more important to you to save money now, spend money later, or would you rather spend a little bit more now? So it's really about a risk tolerance. If I kind of think of it that way. Some people want predictable costs, others like to pay as they go. Either way is fine, but knowing what you're getting into, I feel like is really important.
So it
So,
really is customizable.
Hmm.
yeah, our goal is to align the coverage with how someone's actually going to use their coverage.
Hmm. Lindsay, you mentioned risk based.
Mhm.
When it comes to Medicare and the insurance, we're used to that underwriting, guaranteed
Mhm.
issue. How does guaranteed issue with Medicare, how does that apply? How does that work?
So guaranteed issue, and by definition means that you can enroll without any medical underwriting. So
Hmm.
Medicare itself is guaranteed issue. And when underwriting comes into play is if you are enrolling outside of your initial enrollment period. So again, that timing is really coming into play.
Okay.
So there's a couple of windows when the Medicare supplements are guaranteed issue as well. Most of the time, it's when you're turning 65, or if you're working past 65 and you are enrolled in employer coverage, you can usually transition into a Medicare supplement plan at a guaranteed issue status. But other than that, you may have to go through medical underwriting for a supplement plan. Medicare Advantage, however, is guaranteed issue. And so there are certain times of the year when you can enroll in Medicare Advantage and a carrier cannot deny you and they cannot charge you anymore due to a health condition. But if you miss those windows, your options may really become limited. So again, the timing is critical and working, with
Hmm.
someone that can help
It
guide you
knows.
on,
Yeah.
yeah,
Right.
on what those time, time frames are, especially if someone is needing guaranteed issue coverage.
Hmm.
Yeah. I think of my parents, right? They're going to
Mhm.
be this year 70 and 71. And I didn't know they had to go through all of this stuff. But like I think of, my parents are pretty healthy, but had they been dealing with health issues and
Mhm.
then navigating this mess, like
Right.
that's a lot when, healthcare in general is confusing, but if you have health issues on top of it and you're over 65 and yikes. Yeah.
Yeah, things
Hmm.
can change real quickly too. I mean, plans change year by year. And so that's, another thing, to have somebody that touches base and says, hey, this is the coverage that you have now, but it's changing for next year.
Hmm.
And so as their health changes and their care needs change as they get older, plans change too. So really having a conversation year after year is really important.
I
Hmm.
love that.
Hmm.
So, will I automatically be signed up for Medicare when I turn 65? And I think that's an interesting question because, my forte is under 65
Mhm.
products before this. And one thing I'd always get told is, hey, can you go ahead and cancel my plan? I'm turning 65. Like they just think it's automatic. So, walk us through that.
So some people are automatically enrolled in Medicare when they turn 65, but many are not, especially with people working past 65 now. It really comes down to whether they're already taking Social Security or not. So if they are turning 65 and enrolling in Social Security at the same time, they will automatically be enrolled in Medicare. Or if they were previously receiving Social Security prior to 65, then they will automatically enroll in Medicare at 65.
Hmm.
But if you're still working or delaying Social Security, then you actually have to actively enroll in Medicare A and B. And it's often one of the most confusing things that we come across because we, have serviced the under 65 market too. And clients think it's just automatically going to happen and automatically going to be taken care of. But a lot of people that pay for their own health insurance actually have to actively enroll in Medicare that 3 months prior to turning 65.
So you got
Wow.
to
If they
speak to an
don't,
agent. You won't know.
Well,
yeah, and
l-
there can
l-
be penalties if you don't do it in time.
yeah, Lindsay, what happens if someone does delay enrolling in the parts of Medicare?
It will delays can trigger permanent late enrollment penalties. So it's not just a slap on the wrist in most cases. It's not a
Wow.
one-time penalty. Penalties can last as long as you have Medicare. So that can be 10,
Wow.
20, 30 years. It can also disrupt your coverage. So if you don't enroll within your initial enrollment period, you could have a gap in coverage for 6 months, 7 months. There's different times of the year that you can get your coverage to start depending on when you were supposed to enroll and how long after you waited to actually enroll. It can also limit your plan options. So, not everyone should enroll in Medicare at age 65, but you should at least know the rules and have,
Hmm.
an educated decision
Hmm.
in making those, timing decisions on when is Medicare right for me.
Hmm.
Yeah.
Wow.
So you don't mess around when it comes to Medicare.
No,
Mm-mm.
honestly, if you even, some people think I don't need a prescription drug plan, I don't take any medicines. But what they don't realize is every month you go without enrolling in a Part D plan, you're penalized once you do. So let's say that for the first 3 years you're on Medicare, you don't take any drugs, you don't pay for a drug plan, and then all of a sudden 3 years later you've got expensive medications and you
Yeah.
go to enroll in your Part D plan, you will be penalized not only for the 3 years that you didn't have coverage, but for every year that you carry coverage after that.
Now,
Wow.
Lindsay, now I can see you have to have a health license
Mhm.
to offer Medicare, but now I can see why you have to have so many extra certifications and
Mhm.
qualifications from the government, so much CMS and oversight, because you need to know all that so you can really give sound good advice to your client, to
Absolutely.
navigate them through that process. I can see that.
Yeah,
Yeah.
we do a lot of continuing education and CMS training, and then
Mhm.
every single carrier out there puts us through a rigorous training and certification process every single year.
And just to kind of piggyback off that, with this new partnership, should you choose to join our Medicare division as an agent, Lindsay, walk them through because, and I'm giving her kudos because she's one of the best Medicare trainers I've ever seen.
Mhm.
They're very hands-on at 360. So talk through if someone were to join this partnership with InsurTech Hub and 360 Benefit Solutions, the kind of support they would get because, I mean, this partnership's a game changer.
100%. So we can take someone who has never sold Medicare before and maybe has been in the under 65 or the group market and thinks, it would be a great thing to add to their portfolio. We can take you from 0 to 100 before the next open enrollment. So
Mm.
we offer very basic Medicare training and all the way up to very specific product training. So we have like an 8 week Medicare training series every
Wow.
summer to get people ready for AHIP. AHIP is kind of the standardized Medicare test that you have to take every year. And, even though I've done it for 20 years, actually, I'm exempt after this year. Well, no, that's my continuing education, not AHIP. Never mind. I was
Wow.
excited. But for AHIP, you have to take it every year. The first time can be very intimidating. So we like to have a couple of trainings before it comes out in July of every year. And we structure the trainings both before and after to make sure that you have kind of the basics down before having to take that test. You get 3 tries, but not only do you have to do AHIP, you have to actually certify with each carrier that you're going to represent. And so we do product specific trainings. We have, a ton of training options. And some people that are experienced in Medicare, they may already know this stuff. But I've worked with people that have more Medicare experience than me that still tune into some of the trainings
Yes.
because everything changes every year.
Yeah.
So we like to keep the updates fresh and make sure that people are getting the right information to stay compliant.
Hmm.
Compliance is key when it comes to Medicare and CMS. You don't want CMS coming after you for a compliance violation. We try to avoid those at all costs. So the more we
Hmm.
can do to prepare you, the better off we all are. So yes, we will make sure you're prepared no matter what level you come in at. If you're experienced, then we'll just here, for whatever support that you need, maybe to help get you some additional carriers or,
Yes.
put you in
Hmm.
touch with local carrier reps, get sponsorships. We can help on
Super
a lot of different
hands-on.
levels.
Yes, I love that.
We actually talked about that yesterday in our industry, and Michelle and I, that's our mission at InsurTech Hub is we're going to have great carriers, great products, the best comp levels, but training,
Mhm.
education, that's just, some other people do a really good job at it too, but we just want to make sure that anything that we offer, that we have that training, that education, that coaching behind it, so they can just plug in. I always say the more you learn, the more you earn. And
Absolutely.
yeah, so we're excited. So you're um, okay.
Yeah,
When you're educated, that's the easiest way to get referrals, and this is a
there it
referral
is.
business.
Yes,
There it
correct.
is. Yes.
Hmm.
I had one more question, just real quick about dual coverage. So
Okay.
can you have dual coverage with an ER plan and a Medicare plan?
Yeah, so if you are employer covered, so that's, a big question because a lot of people, like we said earlier, turning
Right.
65 and still working.
Yeah.
So it actually depends on the employer size, on how many employees your employer has. That will determine whether Medicare pays first or the employer plan pays first. It's kind of a tongue twister. But it's important because you may or may not be required to have Medicare Part B. So
Hmm.
if you're going to have employer insurance and have Medicare, you have to have Medicare Part A.
Okay.
But A is free. So that's easy. But Medicare Part B is not. It can be, $250, $270 a month. And if you don't need it, then you don't want to have to pay that extra premium,
Right.
especially if you have employer coverage.
Hmm.
However, if you may be in a situation where your employer requires you to have A and B, and so that's when it's a bigger decision. If I'm going to have to pay for Medicare Part B anyways, then we look at, okay, what is your employer plan coverage and cost compared to getting a Medicare supplement or an Advantage plan? So that's a whole different conversation. But yes, the answer is yes, you can, but it depends on how big of an employer you have
Okay.
and whether or not Medicare Part B is required, on whether or not that's the best choice.
Good to
You know,
know.
Lindsay, we're in the group business too, and
Mhm.
excuse me, we're seeing more and more where people are over 65 and they're working full time and
Mhm.
they're still on the group medical plans. So we're seeing that tends to be more and more prevalent as time goes on.
It
People are
does.
working.
And
Hmm.
employers in that position, they actually have a choice on whether to continue to offer their employer plan to those individuals over 65.
Hmm.
So we work with employers often to help. Let's take a look at it. Let's look at your census and see who's over 65. If it's costing the employer $1,000 a month and the employee $1,000 a month to be on that plan, it makes sense for no one.
Correct.
So that's
Hmm.
another, benefit of having a broker.
Hmm.
So wait a second. So did Todd bring that up because when I turn 65, he expects me to keep working?
Yes.
That was part of the contract. You said you would never retire, but it's like no, I'm just joking.
Oh, I'm 45. Shoot, I still got 20 plus
Hey,
years then.
I don't really, when it comes to age, I've never really thought of age too much. But actually, on this call today, 65, and I've still got a little ways to go before I turn 65, but I'm closer to 65 now than I am to 50 on the other side of that. So I was thinking, my goodness, I'm still 6.5 years away. I'm 58 and a half now. So but you always use the half as you get older.
Yep.
It's like, it's like,
Yeah, it matters.
but but it's not that far off when you think
In
about it. In
four
the big
years, you
scheme of
better
things,
start
yeah.
navigating it per Lindsey's
Yeah,
advice.
4 years, no, 6.5. It's like, yeah.
Yeah.
So no,
Yep.
but yeah. But Lindsey, you mentioned earlier you're going to be exempt from continuing education because you're 20 years in the business. Is that how long you've been in the Medicare business? Have you been, serving your clients for that long? Or I'm just kind of curious
Yes.
of your background and to work with you. Does it cost anything? Or so just a couple of those things we'll let our folks know.
Absolutely. So yes, this is my 21st year in the business.
Yeah.
And I didn't start out in Medicare, thank you. I started out in the under 65 exclusively. And as my clients were aging, I decided to learn Medicare because why not expand your business? You want to have multiple lines of business. And I loved Medicare. So once I got into Medicare, I really wanted to learn everything that I could because helping people with those kind of decisions, it's very rewarding because, people are very confused. There's a lot of
Hmm.
options. There's a lot of talk. There's a lot of advertising. But yeah, so I have been doing Medicare for about 18 years. And there's absolutely no cost to work with a broker. If a broker tries to charge you money, find another one.
Hmm.
I have heard of people out there charging for their time and their expertise, but we get paid by the insurance companies. So there's no cost to work with us. Our compensation comes directly from the insurance carrier, no matter what plan or what program is chosen. So I always like to let my customers know that.
Hmm.
Sometimes they think, oh, you're incentivized for, me choosing this Humana Medicare Advantage plan, for example, over, a different one. And that's not the case. It's a standardized rate that the agent gets paid no matter what. So
Hmm.
we like to help everybody, the same. The plan's going to cost the same to them as well, no matter whether they use an agent or not. So if they decide to go on Google and read the Medicare and You handbook that's 800 pages and do it themselves and cause themselves a headache, they can do that. But for the same exact monthly premium, they could have an agent that can explain it to them in 30 minutes and help them make those experienced decisions, have the experience of a broker to make those educated decisions and give them ongoing support as well.
Yeah.
It
So
doesn't
I
have
always
to be hard.
it doesn't have to be hard. And, I always like to let them know that really the cost can come when making an uneducated decision.
Ooh.
Because it's a long-term choice. A lot of
Hmm.
times it's not just what my insurance is going to be today. Like a lot of times you might get short-term health insurance for 3 months whenever you're in between jobs or something like that. But this Medicare decision can stick with you for 20 years. So
Wow.
making an uneducated decision can end up costing more money than working with someone who has the experience and the knowledge because it doesn't cost them anything else.
Yeah.
Hmm.
Well,
Wow.
I'm glad Lindsey's my personal friend because, girl, in 20 years, I'm going to be knocking on your door.
That's right.
Well,
In 6.5, I'm gonna be knocking on your door.
no, you have to start early. Remember, that's what we
Uh-huh.
learned today. So, like,
Just 3 months early, not too early.
okay,
You
okay.
can start 2 years early figuring
See?
out when you want to take Social Security
Okay.
because
Uh-huh.
that can affect the cost of your Medicare Part B
Okay.
later, when you turn 65. So it's definitely, a conversation to have with your financial advisor at least at 63 to figure out, okay, am I going to take Medicare at
Right.
65? Am I going to wait? But yes, 3 months before it's time to get Medicare is when you need to talk to one of us.
Gotcha. Hmm.
Yes. Lindsey, what is your company's website?
It is 360bsa.com.
Awesome.
Hmm.
Well, Todd and I are incredibly blessed for this
Yes.
friendship, but also
Hmm.
this new partnership. The
Hmm.
Medicare division is new to InsurTech Hub and
Hmm.
Life Division. That's our next
Hmm.
podcast.
Hmm.
And we're just so blessed. We've got amazing people in our background, amazing packages for our agents. So if you are listening to this call, it is
Hmm.
worth a discovery call to learn
Hmm.
more about the new Life and Medicare division at InsurTech Hub. I mean, the best way to grow your business is to grow your portfolio.
Diversify.
Hmm. Hmm.
Yes, yes.
Correct.
So thank you. We had a
You're
wonderful
welcome.
dinner with you and Allison last night, and we're ready to rock and roll.
We're ready. Bring it on.
Yes, yes. All
We're
right,
very excited.
everyone. Well, let's do one more cheers.
Yay!
To a successful 2026 and her Diet Coke. I love you.
Oh, thank you,
I actually
Lindsey.
have a hat, and I got two people got me sweatshirts that said like I need a Diet Coke or but first Diet Coke. So yeah, that's kind of my thing.
You know what? Look at this. My dad got me this, no talkie before coffee. Like there are rules in life and they must be followed. Well, thank you everyone for tuning in. We are just so thankful that you join us on these conversations. Like they're really eye-opening. You know, every single week we have a different subject, a different speaker. You know, it's all about knowing and education. It's powerful. And so sometimes I love what Lindsey said earlier, you know, there's titans in the industry, but sometimes you just need a good refresher so you don't get in a cookie cutter mold. And that's what we want these podcasts to be about. We want to introduce you to these amazing partners we're working with, but also just have you get in the nitty gritty of the product.
Absolutely. And there's never a better time to start than now.
Yes.
Amen.
Yes.
Thank you for having me today.
Yes. Take care, everyone. And we'll see you next week.
Thank you, ladies. Take care. Bye-bye.